Hello and welcome to our first topic this end term. This is Pelvis 1 and we are going to talk about the pelvis or pelvic fascia, pelvic peritoneum, and then the pelvic wall muscles. At the end of this module, the students must be able to identify the bones of the pelvis and their major features and function, differentiate the male and female pelvis, identify the pelvic fascia and peritoneum, and identify the lumbosacral plexuses. So, what is the pelvis? So, it is actually a bowl shaped bony structure, and it is identified or described as a basin, which is equal to a pelvic girdle or the bony pelvis itself. So, its main function is the transmission of the body weight, especially from the upper body down towards your vertebral column, towards the femurs. Okay, so it actually connects your upper body down to your and then your lower body. Okay, so its other functions include contains, supports, and protects our lower GIT or the organs of our lower GI tract, urinary tract, and male and female reproductive organs. Now, aside from that, it also contains nerves, blood vessels, and lymphatic tissues. And lastly, it serves as attachment for the muscles. Some are for our trunk, abdomen, and some are for our lower extremities. So here is our pelvis. This is a picture of our pelvis. So our pelvis, not to confuse you guys, as what we have discussed last time, our pelvis consists of four bones. We have the pelvic girdle, which we also call as your hip bones or the os coxae. Again, pelvic girdle as the hip bones or the os coxae. Now, these hip bones are those what we call your ilium, ischium, and their pubis. Now, aside from the pelvic girdle, we have the sacrum and then the coccyx. Now, if you look at this hip bone, guys, it is again divided into three. We have your ilium here, the pubis here, and then the ischium here. So in our ilium, we have the iliac crest. So from anterior to posterior, we have the iliac crest, and then we have here the bony structure, which is your anterior superior iliac spine. And here at the posterior is your posterior superior iliac spine. Aside from that, below or under your anterior iliac spine is your, of course, anterior inferior iliac spine. Same as with your anterior, we have also your posterior inferior iliac spine here. Now, let's go to here to in your pubis. So this pink area is your pubis. So we have the body of the pubis, the inferior ramus of the pubis, and what we cannot see here in the picture is we also have the superior ramus of the pubis. Now we proceed with the ischium. So this violet area is your ischium. Now your ischium has its ischial body here, the ischial spine, the ischial tuberosity, or which is your sit bone, and also your ischial ramus. So, the if your ischium and then your pubis meets, it forms actually your obturator foramen. Okay. Now, these three bones are fused at the center, and this is what we call your acetabulum. Okay, this is where your the head of the femur connects to form your hip joint or your acetabulofemoral joint. Now, here's another image, the medial view of your hip bone or os coxae. So this again is your iliac crest, the ilium. Next, here in your ilium is your iliac fossa. Okay. Now we have here your arcuate line. Next, we have here the posterior superior iliac spine, the posterior inferior iliac spine, and then the auricular surface. So most probably in this surface is where your sacrum will connect or will join with your hip bone. Okay. Aside from that, we have here some other features, which are your greater sciatic notch and then the lesser sciatic notch. In between these notches, we find your ischial spine. Now, we have here again your ischial ramus, then the inferior ramus of the pubis, the pubic tubercle here, and then the superior ramus of the pubis. Aside from that, we also have here your obturator foramen. Okay. Now, next is the sacrum. So our sacrum consists of five rudimentary vertebrae fused together to form a single wedged-shaped bone with an anterior concavity. So take note that the anterior portion of your sacrum is concave compared to its posterior portion. So the upper border of our or the base of the bone, or the upper border of or the base of our sacrum is here. So it's actually connected or articulates with the fifth lumbar vertebrae. The narrow inferior border articulates with our coccyx. So laterally, the sacrum articulates with two iliac bones to form your sacroiliac joint. So this is where your iliac bones will connect. So other parts of your sacrum includes the promontory, sacral promontory, the ala or the wing of the sacrum. We have here the transverse ridges, one, two, three, and four. And at the sides of our transverse ridges, we have your ventral sacral foramina, where your some of your nerves pass through. And then, aside from that, at the posterior part of your sacrum, we have the sacral canal. We have here the superior articular facets, which will connect to the inferior articular facets of L5. You have here the sacral tuberosities on both sides. We have the dorsal wall of your sacrum, the medial crest, which is found posteriorly, and then the sacral cornu here. So if we have the ventral sacral foramina on the left, we also have the dorsal sacral foramina. Next, we have the coccyx. So our coccyx consists of four vertebrae fused together to form a small triangular bone, which it actually articulates at its base with lower end of the sacrum. So this is where your sacrum articulates with your coccyx. So the coccygeal vertebrae consists of bodies only. So as you can see here in the picture, but the first vertebrae possesses rudimentary transverse processes and the cornua. So this is your cornua, and then these are your rudimentary transverse processes. So the cornua are the remains of the pedicles and superior articular processes and project upward, as you can see here, to articulate with the sacral cornua. So both coccyx and the sacrum has their own or have their own cornua. So let's discuss first the pelvic brim. So as you can see here, our pelvic brim divides the pelvis into two parts, which are your true and then the false pelvis. So you can see here in the picture, this is your pelvic brim. So it has its own boundaries. You have your posterior boundary, which is your sacral promontory here. Next is the iliopectineal line here, which is considered as the lateral border. And then the anterior border of your pelvic brim is your pubic symphysis here in front or anteriorly. Now, as you can see, your pelvis is oriented just this way, as you can see here in the picture. You need to understand that the correct orientation of the bony pelvis relative to the trunk is with the individual standing in the anatomical position. So this is a female patient who is standing in the anatomical position. So if the patient is standing in the anatomical position, this is the orientation of your pelvis at the right side of the slide. So the front of the symphysis pubis right here and the anterior superior iliac lines right here lie in the same vertical plane. So this is our vertical plane, okay, the blue area. So this means that the pelvic surface of your symphysis pubis faces upward and backward, and the anterior surface of the sacrum is directed forward and downward. So this is the anterior surface of sacrum, so it's actually directed downward and forward, and then your pubic symphysis is directed anteriorly and backwards. Okay, now let's differentiate the false and then the true pelvis. But let's start first with the false pelvis. So your false pelvis is a part of the abdominal cavity. Okay, so it has its own functions. It supports the abdominal contents. It helps support gravid uterus at the third month of pregnancy. And it also helps to guide fetus into the true pelvis in the early stages of labor. So if your pelvic rim has its own boundaries, your false pelvis also has its own boundaries. So the posterior boundary is the lumbar vertebrae right here. You can imagine there's a lumbar vertebrae here. Next is the lateral boundary, which are your iliac fossae, one on the right and one on the left, and of course the iliacus muscles. Now, we also have the anterior boundary of our false pelvis, which is the lower part of your anterior abdominal wall, which cannot be actually be seen here in our picture on the slide. But now next, we have the true pelvis. So this true pelvis is important for obstetrics in females because um, usually it is because of it forms the bony canals through which the child passes through during birth. Okay, now your true pelvis, we can identify some of its parts. We have the pelvic inlet, pelvic outlet, and then the pelvic cavity. So let's go through it one by one. We have here the pelvic inlet. So it is also known as the pelvic brim. So it they have the same boundaries. So the pelvic brim or the pelvic inlet has its posterior boundary, which is the sacral promontory. Their lateral border is the iliopectineal line here, and the anterior border is the pubic symphysis. Okay, so this is your pelvic inlet. Now, next is your pelvic outlet. So this pelvic outlet is diamond shaped. So from an obstetric standpoint, because the sacrotuberous ligaments are strong and relatively inflexible, they are considered to form part of the perimeter of the pelvic outlet. So thus, the outlet is diamond shaped with the ischiopubic rami and the symphysis pubis forming the boundaries in front, and the sacrotuberous ligaments and the coccyx forming the boundaries behind. So our boundaries for the pelvic outlet includes the anterior border, which is the pubic arch right here. Take note, this is the anterior and this is the posterior. So we have the pubic arch here. This is actually an inferior view of our pelvis. Next, we have the lateral border, which includes your ischial tuberosity here and the sacrotuberous ligament, which is not visible in this image. And we have here your posterior border, which is the tip of our coccyx. So this is our pelvic outlet. Now, let's define our pelvic cavity. So this is a short, curved canal with a shallow anterior wall and much a deeper posterior wall that lies between the inlet and the outlet. So if this is your pelvic promontory of the sacrum, this is the pubis, and then between the promontory of the sacrum and the pubis is your pelvic inlet. Next, here, the area here is your pelvic outlet from the tip of the coccyx down to the pubic arch, and in between them is what we call your pelvic cavity. Now, let's differentiate the pelvis of a female and then a male. Okay, so the false pelvis is shallow in female and deep in the male. Aside from that, let's define or differentiate their pelvic inlet. So the pelvic inlet is transversely oval in females and heart-shaped in males. So it is because of the indentation produced by the promontory of the sacrum in male. So this is the indentation for the sacral promontory. Next is for the pelvic outlet. So the pelvic outlet is larger in female than in the male. Okay, again, pelvic outlet is larger in the female than in males. So the ischial spines are everted in the female but inverted in the male. Aside from that, we also have here the pelvic cavity. So the pelvic cavity is roomier in the female than in the male, and the distance between the inlet and outlet is much shorter. Aside from that, we also have here the supra or the subpubic angle or the pubic arch. So in this pubic arch, it is more rounded in females compared to males, which are more narrower. Okay, so here's another image of our comparison of the male and the female pelvis. As you can see, the pelvic inlet of the female patient is rounder compared to the male, which is a shape of a heart. Okay, now the pubic arch in females is wider compared to the pubic arch in males, which is narrower, and the sacrum concavity in females is in males is actually more. The male sacrum concavity is, I mean, the male sacrum is more concave, whereas the female sacrum concavity is more flattened. Okay, again, the male sacrum is more concave than the female, which is flat, more of like a flat surface. Okay, now next we have here the four types of the pelvis. So we have the gynecoid, the android, the anthropoid, and the platypeloid.